Hello, my name is Brittany Martinez, and I'm a nurse in the emergency department. And I'm going to teach a 5-course series, a staff development series involving sepsis patients and what we can do as nursing staff in the emergency room to improve patient care, patient outcomes, and focus on early recognition and treatment. So the first course that we're going to teach is basically Sepsis 101. When you start this course, it's going to involve an online module with a PowerPoint. The first thing you're going to do is complete a survey. The purpose of this survey is basically for us to gather knowledge and data on how much you actually know about sepsis. Considering that in our emergency department, there are wide varieties and ranges of experience. We have new graduates all the way to very seasoned nurses. So we need to actually understand everyone's knowledge base and things that we can better focus on. But things you're going to need to know in this course is basically what is sepsis, the ins and outs of sepsis, okay? We're going to talk about and learn about the populations most at risk, mortality rates for patients admitted into the emergency department and the hospital and what their mortality rates are, and also the prevalence of sepsis diagnostics in the ED. How often do we actually see it, and how often do we discover it later on in the patient's emergency room visit? We're also going to talk about data involving the emergency room and how often patients are actually diagnosed with sepsis in the emergency department. So Sepsis 102 is actually a step up, and it's an assessment. We focus on the assessment part and early recognition of sepsis, okay? So things you're going to need to know in this class is going to be, it's going to be in a classroom with a PowerPoint presentation. There'll be handouts with a printed sepsis protocol for our department, as well as some hands-on practice with the mannequin sim arm. In this class, you're going to need to know the early and late signs of sepsis and the most common types of sepsis in the emergency department. We're also going to discuss rapid techniques on assessment for patients that we think might be a potential candidate for a sepsis protocol. This technique we're going to focus on is called SOFA, and it's Sequential Organ Failure Assessment. It's very quick and very rapid, and it helps us decide whether or not we want to start the initial sepsis protocol. You're also going to need to know and understand the nursing responsibilities for this early recognition and intervention. We're going to need to go over in detailed education for the sepsis protocol, including labs and monitoring the patient. We're also going to practice the appropriate way to draw blood cultures and lactic acid levels on the SimMan arm, so that way they're done appropriately, and that is the only way that they are beneficial for the patient during their care. So Sepsis 103 is basically focuses on diagnostic interpretation and nursing communication with emergency room physicians. This is going to be in a classroom setting with a PowerPoint presentation with myself. So we're going to talk about lab value interpretations. For example, lactic acid. When it's elevated, what does that mean for us? What should we anticipate? As well as platelet levels, white blood cells, all your abnormal labs or potential abnormal labs for septic patients. And we're also going to talk about how we should appropriately communicate our concerns to the emergency MD staff. Advocating for aggressive intervention when it's necessary, advocating for starting the sepsis protocol as soon as possible. We're also going to talk about what steps to anticipate after diagnostics have come back, whether it's radiology, whether it's laboratory. We're going to talk about, and you're going to need to know what steps you need to anticipate when treatment begins. We're also going to go over case studies for practice and do some group work, do some scenarios, some live scenarios with some of my other staff members who are going to act as patients, and we're going to expect you to interact as if this was a real patient and what you would do. And we'll go through all those steps. And one of us will be there monitoring and assisting you in the next step process. The next class is going to be Sepsis 104, and this is going to focus on medications and treatment along with maintenance until we get to the inpatient units with these septic patients. So this is going to be a classroom setting with a PowerPoint and hands-on practice, okay? So we're going to talk about the different antibiotics, the most common antibiotics part of this protocol. So you're going to need to know those and understand how they operate, how they work, and how we initiate those to patients. Also, we're going to talk about fluid intervention, and you're going to need to know, based on the protocol, how much fluid we need to give a patient, as well as how we adjust that rate and that volume based on patients that could potentially get into fluid overload. And then we've created a whole new problem. And we're also going to talk about medications and ways to control fevers. We're going to talk about monitoring these patients. That includes vital signs, medications. So you're going to need to know how these medications trend, how to adjust them when vital signs react to medications, and how we appropriately change our interventions. We're also going to talk about what happens when patients actually don't respond positively to our interventions and our treatment. So you're going to need to know and practice how to set up for central lines, how to set up for potential intubations, things that are more emergent and necessary for that patient's care, to try to turn them around. So you're going to need to know, we're going to practice hands-on how to set up for central lines when it's necessary, appropriate consents, as well as how we monitor them, the CBP monitoring on the actual monitor. We're also going to, at the end of this course, we're actually going to complete a multiple choice 10 question test. These questions will come from all 4 of these course curriculums and content that we went over in this series. There'll be fact-based questions as well as patient scenario questions, as well as nursing requirement and nursing intervention questions. So the 5th course in this staff development series is actually basically Sepsis 105, and this is more of a wrap-up and communication course. So this is an online module, and it's basically a summary of everything that we've learned. We can voice concerns, things like that. So you're going to need to remember and recognize everything that you've learned, and so we're going to go through you can go through the online module. And it's basically in summation of all of your nursing responsibilities. You can also post questions and comments about the curriculum after you complete the module, and so that way your concerns can be heard and we can change our curriculum based on comments that you've made and concerns that you have. So I look forward to teaching this curriculum to you. If you have any questions, please email me. Also, if you have any concerns or questions involving accessing the online modules, please let me know and I will get back to you and give you the proper instruction. All right, thank you so much. We'll see you in class.